One local boy was born with a congenital defect after 19 months and numerous surgeries. His parents are hopeful their hospital stays are going to be less frequent. It's this edition of Covenant Children's Stories of Strength. Like most year-and-a-half-old babies, Jed is a happy one.
He's always like this.
Yes, you'd never know anything was wrong with him.
He was in renal failure, and we didn't even know anything was wrong with him.
He was born with one kidney and a congenital defect, esophageal atresia.
His esophagus is not connected to his stomach.
Never was.
And hydrocephalus.
You have cerebral spinal fluid around your brain, and that's absorbed by your body. The hydrocephalus is your body, it doesn't drain properly, so it just swells around your brain. It makes your head bigger.
His first surgery at just 5 days old, and he's had 12 since.
4 surgeries for the esophagus part. He had 5 surgeries on his head for his hydrocephalus and the infection.
Now, the main focus is finally getting his esophagus attached.
In the current process of stretching his esophagus to bring it closer to his stomach so they can connect them together. It's a series of surgeries that he has to have.
Because of this condition, he's spent his whole life with a feeding tube.
Believe it or not, that's a very hard thing to teach a child to do at 19 months, is how to eat when he's never eaten.
So Cindra and Joe Bankston are having to teach their child something that most of us don't think twice about.
It's called sham feeding, and we do that. We're teaching him how to eat, even though it just runs right out his little fistula.
Yeah, he's just got a hole right here in the middle of his chest, and it just runs right out everywhere.
Despite many messes over the past 19 months, they've had some help every step of the way.
They're so compassionate here.
Covenant Children's is just been a blessing. They've saved our son on so many occasions. I can't even express it. It's just amazing.
You can't play
The
with
staff here is great. The people are wonderful.
Their advice for families going through similar situations?
Just take it one day at a time. That's all you can. You know,
it's hard, but if you take it one day at a time,
it's not as overwhelming.
After 19 months, the Bankstons can see the light at the end of the tunnel.
We can get his esophagus done, then we have months and months of physical therapy to teach him to eat, and hopefully we can get all that stuff behind us and get him to eating like a normal child.
And taking their own advice, moving forward one step at a time.
Looking back at it, I never would have thought that we could have come this far. You know, I mean, he's been through so much.
Jed did have one more surgery this weekend, and the doctors were able to connect his esophagus to his stomach. His mom says surgery was successful with no complications. Jed is still intubated and sedated in ICU for healing and rest.